Hi guys, welcome back to my channel, Howard Grad RN DNP student. Today I would just like to talk about what happened this past weekend at work. As you know, I am a psychiatric nurse and I rarely do videos on the ongoings in the hospital because of HIPAA. Patient information is protected, it's private. So I can't really discuss anything specific about a patient as far as like anything that might identify the patient as in their name, and I can't even disclose where I work, but I can talk about some of the cases, and I think that's what I'm going to do so that these videos can be educational as well as entertaining. Well, this past weekend I was assigned to a unit that was short staffed. Now at this hospital where I work, a lot of the times they don't have enough people working, so of course my unit was short staffed. And on this particular unit, we had two one-to-ones. Now, when a psychiatric patient is on a one-to-one, that could be for many different reasons. You may have a one-to-one for self-injurious behavior, meaning that the patient's trying to perhaps harm him or herself by whatever they can find. They will kind of self-mutilate. That's self-injurious behavior. But this particular day, we had a patient on a one-to-one for assault, and then we also had another patient on a one-to-one for protection of self and others. I was on the unit, it was myself and the LPN, and we had, our census was 18 patients. Now, this unit was high acuity. There was an incident. There was an incident this evening. What the patient did is, there were two patients involved in the incident, and the ages of the patients were 24 and 28. No, I'm sorry, 24 and 26. Now, the 24-year-old, what she did was she actually punched the 26-year-old in the eye, and she also, in her left eye, and then she also hit her on her left hand. She actually sprained her thumb. Now, again, because it's a psychiatric institution, because it's short staff, oftentimes there's just not enough assistants working to keep everybody safe. And I'm just being honest, but that was the situation on this unit. So the patient went up and she punched the patient in the eye, and she sprained her thumb. Now, I called the medical doctor. He came down and examined the patient. The doctor came in, assessed the patient. He wrote an order for Tylenol, and he left. He also actually wrote an order for ice pack, but we didn't have any ice packs on the unit. So needless to say, there was tons of paperwork with short staff. So that entire evening, it was eventful, but you know what? We made it work, as we always do, because our number one priority is keeping our patients safe and keeping our staff safe as well. So that was Saturday. Now, on Sunday, I was assigned to another unit. Now, in this particular unit, the young lady or the patient was assigned 2-to-1 for assaultive behavior, meaning that she had two staff sitting with her to keep her safe so that she doesn't hurt herself or hurt anyone else. So she was on 2-to-1 for assault. I went into this patient's room to medicate her. I gave her medication, and nobody told me not to go close to this patient. So I went up to this patient, gave her medication. I calmly walked in. I handed her medication juice, and she threw the medication juice in my face. I had my goggles on because we're in the midst of a pandemic, and I also had on my mask, but that protected me. She could have spat in my face as well, but fortunately she did not. So when she threw the juice in my face, I walked out of the room, and then her 2-to-1s pretty much redirected her. They didn't physically touch her, but they did redirect her. Now, later on the unit, we had another patient who decided that he wanted an injection. And what he tends to do when he wants an injection, because he's higher functioning, is he will try to manipulate the staff, okay? Manipulate the nurse into giving him an IM, which is an intramuscular medication injection, because we do have some patients that are drug seeking. So he has a tendency to destroy the furniture. So he actually punched holes in the wall, and we had to call all available help. Psychiatrist came down, but we were able to talk the psychiatrist out of writing an order for an injection. So instead, the doctor wrote an order for PO medication. Now here you have it. The doctor wrote an order for Benadryl 100 milligrams and Haldol 10 milligrams. The patient refused Haldol 10 milligrams PO because he said he was allergic to Haldol, but he did take the Benadryl 100 milligrams. But the psychiatrist said, well, give it to him anyway. I said, no. I actually refused to give a patient medication where it's indicated in his chart that he's allergic to the medication. The doctor said, well, studies have shown that it's rare that a patient will have allergic reactions or anaphylaxis from Haldol. No, I did not give that patient Haldol. And thankfully, the patient actually, he refused the Haldol because he says, you know, I am allergic to Haldol. So he didn't take it. But he did take the Benadryl. All right, guys. I just wanted to kind of give you an update on my weekend. Oh, there was another incident on the same unit. On the unit that I was told you about, the patient where she threw the lemonade on me. Well, there was another incident later on that day when another patient from this unit came into her room and she choked her. Needless to say, we had to do a lot of paperwork. Of course, the unit was short-staffed, but we got through it. Alrighty, guys. Thank you so much for watching. And remember to subscribe to my channel, guys. Take care. Bye-bye.